Well, hello again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk a little bit more about causes for malocclusion developing in young people. And it can be a lot of different things, in adenoids and tonsils. Oversized tonsils are another big problem. It's a little more dangerous taking out tonsils. You're so close to some vital parts of the neck and the arteries and everything in the back that they're doing that. They miss them. They know how to get around it and everything. Adenoids is not as bad. So a lot of times they just take the adenoids and leave the tonsils. But if tonsils are big, they have the way of measuring them, like look at them back there. And if you've got tonsils that come out and touch one another, they're considered number 4, and then 3 and 2 and 1. And the tonsils that aren't bothering them, they leave them alone. Now I had mine, they took us when we were kids, they carried everybody to a hospital in Shreveport, Louisiana that did this operation for very little or nothing, and they took just took everybody's tonsils out. They didn't give you a chance to keep them or not. So mine were gone. I'm sure they took the adenoid tissue too, because I don't have any of the space there for them. So anyway, we've been doing that for a long, long time, and the tonsils, we don't know of a real good thing that they do for the body, but they probably have something that they add up that helps. But when they block the airway, it's better to get them out of there so that you could breathe properly and breathe through the nose. If you breathe through the mouth, you got a lot of other problems that come up, like you suck debris into your lungs, breathing through your mouth. And that's going through the nose. They stay moist all the time, and they have little hair over there called, and those moist hairs catch the dirt, and then sometimes you have to clear your throat or suck that back. If you swallow it, it doesn't hurt you too much. It doesn't hurt at all in most instances. And so get rid of it, or blow your nose, or we have stuff now you flush the area out there today by kind of a wash, and things have taken care of it. Well, these are things that you need to watch on the developing child as they're growing up. Let's get on with the problem now. Let's see, we've got a young person here. I'm going to see if we put it up. And here's a young lady, and we were using a brick background here, so you don't see it too much, but she's got a chin that's back also, as that other young man had, and you'd like to have the chin out, about this area. I don't know that we got it out as far as we needed it or not, but anyway, that's one problem that this young lady has. And let's take another look at another view of the case. There's a little extra height in the face where this is a little more than it is on the other 3. So you don't want to enlarge it too much, or that messes up. If you get her chin way down like that, that messes the facial structure up. This is a beautiful young lady at this point, so we don't want to enlarge it anymore. I'll take those lines away. Now let's see, let's look at the facial structure. and we have to see her smile. Now when she smiles, we had already started, but she's showing a little more lips gum up here than you should. You would like that gone. So sometimes we trim off the tissue up there so you see more tooth in that area, and it kind of helps that a little bit. And sometimes we have the person extend the lip, and then we try to close this down slightly, or we don't want to increase it as we go through using the braces and stuff to move the teeth around. All right, when we open her mouth and look in here, this tooth is way out of place. Here, this left central over here, we've got a deep bite. The lower teeth come up way up underneath there, and this is coming out. There's not a good space for room in there for the teeth to erupt into the mouth. So let's see. Looking at it from the side, you've got the upper teeth sticking out here, and you got this. Now we look at the molar teeth. The lower molar should be in front of the upper molar. In other words, this fits in something like this between that. And so this is back, and it needs to be brought out further, as we pointed out to start with over here. So we're going to try to do that and maybe bring these teeth back in to some extent. Now the second molars, these are deciduous teeth. The second molars, to get back, second molars haven't formed yet. Or on the other side, the same thing. The lower molar is further forward, so we are in better shape over here than we are the 6-year molars right here need to be brought out in front of this, like that. So we have to bring the lower jaw forward to some extent there. Now there's something wrong up in this area right here. That tooth wouldn't come in like that. The lip tries to catch it, but there's something pushing that tooth out of place right up in that area. So we're going to see there's something in here that's out of place, and it looks like this is a deciduous lateral. We'll get in and see that in the x-ray in just a little bit. All right, here is the problem. One of the problems is this adenoid tissue is not as bad as that other case, but it's down too big. So we're going to have to send this young lady in to get that adenoid tissue removed. And that, keeping the tongue down on the bottom, it's got it spread out a little bit more than it should be. Now, here, the lateral, there was an over-retained deciduous tooth here, and this permanent lateral coming in did not eat that away, and it's pushing this tooth over further. So this is something that should be removed real early when you take the first Panorex and look in here, and this tooth is having a problem there. You need to get that out and let this tooth come down, and then this central coming through there would be in better shape than it is there. All right, let's see now everything back here now. I don't see wisdom teeth forming on this young lady. I see the 6-year molars, the second molars, and there's something going on here, but we don't see anything we could say this is a wisdom tooth developing. So we have to think of not taking any teeth out in this area. If the wisdom teeth are not here, then you try to hold on to these as much as possible in here. Let's look, see. Okay, we go in here and we remove that baby tooth, you see, and this tooth now has more room to come in, and that let this tooth come over in the central. We'll line it up good in here, but we had that over-retained deciduous tooth that we had to deal with. Now this is down further down the line, and we had a tongue thrust problem where she was bringing the tongue out, not biting when she swallows. She'd be closing like that, and that causes the front teeth to come out further than they ought to be. So we've banded these and got these little hook-like things made out of 028 or 030 round stainless steel wire, and we put those on a band and solder that and weld it at the same thing and hold it in place. Now, we still don't see the wisdom teeth forming here, and the second molars are coming in late. See, she's aged 9.5, nearly 10 years old, and this tooth ought to be up in here pretty good, but it's coming in slower than it should. So we knew these things were taking place. And this is our third Pediatric, and we were working on her already. And she's in the mixed dentition. We've got all these baby teeth in here that she'll lose. And then we've got to get these teeth in that space. And there. So we go on here. She's aged 10-8 at this time, and this was 5/14 of 88. And this is the fourth Pediatric we've taken on this young lady. And these teeth are coming down good here, no problem. And we can squeeze them into place here. But we're going to have to get going on that and not let these teeth come forward as much as we might want to. So we use a headgear to hold them back, and we've band the 6-year molars, and we put we go from the 4 to 2, call it a 2x4 arch wire in here, and we're going to maintain or open this space and make sure we've got room enough, and we're going to have to intrude these teeth and raise these a little bit right here to bring that in. And so let's see. Now this is that's the date of birth in there. All right, we've got the 4 anterior teeth are in place. We got a room here, and we've got 3 baby teeth still coming in the mouth like that. And we've got an arch wire in here, so we're opening this space. We're holding it back here and holding these teeth. We're maintaining this space here because we don't have wisdom teeth to fill in the gap back there. So on the bottom, we're doing a similar thing. We got a loop in this wire. It's holding this space out here, and we're using this to stop the tongue thrust, and there to change that. So you got all these little things you think about, and this needs to be done while the child is developing. And the pediatric dentist ought to know how to do these things. They shouldn't be sending this child back and forth to an orthodontist to little bitty things like that. They ought to all be done by the pediatric dentist. And there's no need for the orthodontist to disapprove of their working on the teeth like that. That should be something that's just natural for the pediatric dentist to do. And so let's see what happens on the next. While we're waiting, we're trying to prevent these things from taking place. And this is kind of preventive, interceptive orthodontics that's done during the mixed dentition. And sometimes you get onto something and you can't stop from the changing over, so you have a long, drawn-out period of time that you're working on the child, or else you have something you can do and get through with, and then come back and do the finish orthodontics. There's two ways of doing that, but frequently you would get started on something and something else would come up and something else would come up and you couldn't come out of there, so you had braces on the child for a long period of time while you watch each thing as it begins to develop. So here we've got an occipital headgear on here, which we're elevating the upper teeth and bringing them back in to some extent. And so we measure that force. Now here we've got a shorter arm, right? See, that other case we had, this was coming back and we were picking up the back teeth with this. Up here we're picking up the anterior teeth, and we're going to open the bite with that without increasing the vertical dimension of the face in this area, see? So that's what this is, picking up the upper anterior teeth. And we use a face bow in here, and we just catch it under the arch bar. And these are short, these are somewhere out here, whereas the other one, the bars went back here, and we're putting more force on the back teeth. So there's a lot of different ways of using headgear like this. And headgears are good. They put force where we needed them and do things that we need to get done. Now, I don't know, this lateral is wider than it normally should be, and the space is in there. And there's some reason we're going to close that up as she loses those other teeth. So here's 5 of 88. We're still working on, but we have opened the bite, you see. And we've got these lined up pretty good, and we're still getting some of these baby teeth out. This tooth is a little more prominent here. It needs to be. We'll trim this tissue because she showed the gum tissue a lot when she smiles. So there's a lot of little things you think about when you're doing these cases. Now these permanent 6-year molars are coming in a pretty good place here. These are first and second bicuspids and cuspid, and these are the 4 lower anterior teeth right there. And these are things that the person that's watching this child has to keep up with and watch him. And it may, in other words, we need to start this case way back in the mixed dentition, and we haven't found a place yet. We have taken this off though, and we will have to come back and put some finishing touches to this later on. Now, here we've got the back, let's see, these are the 4 anterior teeth. Right, well, let's see. This is the cuspid, first bite, the second bite is underneath here. Same thing over the other. This is a baby tooth, so this is permanent on that side. So we're still working, watching it very careful. Here's there's upper, these are still upper baby teeth, and we've got the braces off. And that ended that case. But we came back and finished this case up later on, and we had to, you stop at this point and wait till the permanent teeth get there. Now you come back and do the finishing orthodontics after these teeth are come out and everything. So you kind of put braces, put a retainer in there and watch it, and then you come back with the finishing. But here we do not bring this case all the way to finish for me to show you. So I thank you for watching, but this is the way orthodontics is done. We brought this to some point and we could get quit and take it off and put a retainer and hold it at that point and wait for the permanent teeth to come in. Then we come in, if they need further treatment, we do the second phase or the finishing of the orthodontic work. So I didn't think about that when we were talking to you a while ago. So we got it correct though, and those teeth can come in and not have anything else to do for this. So we'll close out here. Thank you for watching, and hope you learned something from all of these videos that we're doing. So I want to close